Good evening. I'd like to welcome everyone to the July meeting of the Pitt County Board of Health. Let's start out with our roll call. Betsy Wallace will conduct a roll call. Yeah.
Tina Dixon. Tina Dixon.
Here.
Martha Engelke.
Here.
Rex Fleming.
Here.
Adam Harrell.
Here.
Scott McIntosh.
Here.
Natish Patidar.
Here.
Kelly Pack-Smith.
Present.
Lowell Spate.
Here.
We have quorum.
All right, thank you. First, are there any public comments tonight? Hearing none, we'll move on to the approval of the minutes of the previous meeting, the June meeting. Were there any, those were distributed in advance by Betsy? Are there any additions or corrections to the minutes? Hearing none, I guess we'll have a roll call. Is there a motion to approve the minutes?
Motion by Rex Fleming.
Okay, is there a second?
Second by Scott
Scott
McIntosh.
Okay, all right. Any further discussion? Nitesh, did you have a question or were you seconding the motion?
I was just seconding the motion.
Gotcha, okay. All right, any further discussion? Okay, hearing none, we'll have a roll call vote for all in favor.
Aye.
Tina Dixon.
Aye.
Martha Engelke.
Aye.
Adam Harrell.
Aye.
Natish Patidar.
Aye.
Kelly Pack-Smith.
Aye.
Lowell Spate.
Aye.
Thank you.
All right, very good. The minutes are approved. We'll move on now to the fiscal report. Marcia Hall.
Well, I am talking to you about period 12, which is the last period of fiscal year 2019, 2020. We are working with the county office to close out the books. That is actually going to be period 13. We normally don't meet in July, so I just wanted to show you what a June would look like. I have consolidated all of the state funds in the bottom. So we had a $421,545 worth of budget amendments for this fiscal year, bringing our current approved budget to $12,066,189. And when you look at the end of June, we have done pretty well. We have a surplus of $798,000. Just want to keep in mind that our Medicaid revenue is positive 22,000. Just want to reiterate that we had decreased our Medicaid this fiscal year because of Medicaid reform, which did not happen. And we also had decreased our environmental health fees because we did not make the mark the year before. But as you can see, it actually has brought in almost $75,000 more this year than we had budgeted. Also, our clinic fees have come in more, $10,000 more, which is, I do accredit some of that to Epic, but we keep our clinic fees fairly low just because of the clientele that we do take care of. We are expecting our May payment, our July payment for June expenses because the state fiscal year ends in May. So period 13 is crucial. That is where the May and June's expenses come in July, so we accrue those funds. But overall, we have a surplus of $798,000 and year-to-date adjusted right on the mark. Is there any questions?
All right, well, this is an action item that'll need to be approved. Does anybody have any questions for Marcia? If you do, raise your hand. Okay, hearing no questions, is there a motion for approval of the report as presented?
First by Tina Dixon.
All right. Is there a second? Lowell Spate. Yeah.
Okay.
Okay, very good. Any further discussion? All right, hearing none, we'll have a roll call vote for approval.
Mr. Fleming has his hand
Oh,
up.
sorry. Rex, do you have a question?
No, I would just second it.
Oh, okay, I'm sorry. All right, I got you. Okay, we're still figuring this out here. So, all right. Let's go ahead and have a roll call vote for,
Okay. Martha
motion.
Engelke,
Approve.
Rex Fleming,
Approve.
Adam Harrell,
Approved.
Scott McIntosh,
Approved.
Natish Patidar,
Approved.
Kelly Pack-Smith,
Approve.
thank you.
all right. Thank you very much. The budget's approved. Do you have another report for us, Marcia, on the grants or?
I do, actually. I just wanted to show you, the grants fall outside of our $12 million approved budget. The Board of Commissioners approved the grants, but it doesn't go into our overall, the 12 million. And I wanted to show you where some of the grants will roll till next year. The ones that are highlighted, those amounts will be rolled from the county office from June to July. The Triple P Positive Parenting Program, that is a state grant that does not roll. So I'll have another update with that. That Triple P, I believe, is around $400,000, and we will update this grant report next month for you. I do have a position status report that was included in your email. Currently today, we have 22 vacancies. That does include the 2 positions that were recently approved by the Board of Commissioners. As you can see, we do have some being advertised with the testing sites that got going yesterday. We are all hands on deck, so hopefully we will review those applications and get those trained and hired as soon as possible. But if you have any questions about that, you can feel free to email me or ask now.
Any challenges with the COVID that has had any impact on your ability to interview or recruit or?
Well, we have just hired 2 actually 3 NEAS personnel that will start on Thursday to help with the breezeway screening. We're hoping to hire 2 more. Having the 3 testing sites is quite daunting for a department that is already with many vacancies. So WIC, their numbers are extremely higher than normal with the pandemic. So they're not eligible to help us as much with the breezeway. So when you take someone away from their normal duties to screen at the door, which you have to have, it is putting a lot of strain on, I guess, regular operations. I'm sure Dr. Silvernail is going to touch base on that, but it's all hands on deck with the testing. And so you're mandated to do certain duties that you can't get out of, but yeah, I think the heat.
We'll be sure and tell your staff that the Board of Health really appreciates their flexibility on this.
We thank you. They would really appreciate that. And I can't say enough for the MIS department. They've been helping us get cell phones for the testing sites, the JH Rose custodian staff, Shelton, they've helped us get tents put up, and the Farmville Recreation Department. I was just there visiting, dropping off a few supplies, but the staffing at these locations have been great and much needed. The Sheriff's Department for security, everybody's been great to work with.
Sounds like y'all responding well to the charge from the county commissioner, so we appreciate it.
We hope so.
All right. Any other report for us?
I just wanted to mention Dentrix is being built, and we're hoping that we will have that in place when school goes back. We are not sure what school is going to look like. But Dentrix hopefully will be in place at the Smile Safari. They are currently working 2 days a week seeing patients, but their schedule is filling up. So we may have to do some advertising since Pitt County Schools may go to a virtual platform to get some of those students over to the health department or certain schools. So that's going to be an interesting project to dissect depending on how schools look in August. But Dentrix is coming along, and we're gonna start the Medicaid cost study report again for 1920 as soon as we possibly can, so we can get that revenue in.
Okay, very good. Do any of the board members have any questions for Marcia? We'll watch for you to raise your hand if you do. All right, thank you very much.
All right, thanks, Dr. Ramsey.
Okay, the next item of business is under old business. It'll be the reopening guidance for Pitt County. You may recall that at the May meeting, Commissioner Colson requested and made a motion that Dr. Silvernail put together a reopening plan for the county. And that was discussed and passed. And Dr. Silvernail did his due diligence late May, early June. And then this was provided to us in preparation for the June meeting. Our June meeting, you may recall, was quite long due to the various items on the agenda. And so we brought this back this time. Folks have had about 5 weeks or so to take a look at it. And I sent it back around this afternoon just in case anybody needed a copy. And then Betsy followed about an hour later. So everybody's got a recent copy of that. Before we have any discussion, Dr. Silvernail, do you have any comments or anything to add?
The only thing I would add, Dr. Ramsey, is that really I would look at this not so much as a reopening guide, but a living with COVID guide. I think it's become increasingly clear that COVID's going to be with us for a long time to come. We still do not have any vaccine. We do not have any effective chemoprophylaxis or some medicine to prevent this. And we as a society are going to have to learn to live with the infection as safely as possible while we still go about our somewhat normal lives. So the other thing I would mention is that parts of it have been rendered moot by changes in the governor's executive orders, but parts of it would still lack the legal authority to be implemented because of the governor's authority.
Right.
So at this point, it would not really be distributable to anyone until the governor's order changes.
Okay. I sent some instruction around yesterday. Certainly if you have other thoughts than what I provided, that basically we could discuss this. Any motion involving passage would have to basically say contingent upon the governor going to phase 3. Otherwise, we'd be out of compliance with the governor's order. And as we heard today, I think we heard that he's not going to go to phase 3 on Friday, which was supposed to be his next evaluation date. So the reopening guidance is open for discussion. Does anyone have any comments or suggestions? Kelly Pack-Smith.
Thank you, Dr. Ramsey. I wanted to just reiterate your last point, which was, if I understood you correctly, if we were to go to phase 3, then these guidelines would be considered. I wanted to just to confirm that there would be an opportunity to reevaluate these guidelines after that happened. The reason why I ask that question is because even if the governor goes to phase 3, we might find ourselves in a situation where Pitt County doesn't maybe look like the rest of the state. And if that's the case, I would not want us to put into place guidelines without having an opportunity to reevaluate them to make sure they fit with wherever we were at that time.
Mm-hmm. Yes, I think that's very reasonable. Mm-hmm. One of the points I talked to Dr. Silvernail about was the bowling alleys that he had addressed here. And as we know, I guess it was a court lawsuit, court order. So they reopened. And so to some degree, but I think the rest of the items here are still pretty much oriented toward phase 2. Dr. Harrell?
I just wanted to kind of expand on what Kelly said. And as well, we don't know how long we're going to continue into phase 2, but I think Dr. Silvernail has done his due diligence and what we asked him to do and coming up with a plan. But I mean, we know at this point, this plan is not something that is even going to be considered in the short term. My take would be to table this until we have more information about phase 3, when it might be, and what the governor's mandates are under that.
Yes, sir. Would you like to make a motion to table?
Let's wait and see if anybody else has anything to add. We can come back to it.
Okay. Yeah, thank you. Does anyone else have any comments or thoughts? Yes, Marty, Dr. Engelke.
Yeah, I would agree with Adam, but I did want to say that I think this is really helpful, what Dr. Silvernail has said, because I think some of the guidance that has come out is so long and so convoluted that this is a nice attempt to make it clear. The one thing that I noted when reading through here that would have helped me is there are several places where cleaning between people using equipment is mentioned, and it's not clear always whether that's the customer's responsibility or the organization's responsibility. And I agree with tabling it, but as we move forward, that I think would be something to clarify.
Yeah, Dr. Silvernail, do you want to address that or?
Yeah, I can clarify that if you don't feel that's clear enough in there, Dr. Engelke. The hygiene things are things that the business owner would do, not something that their client or customer would do.
I think when you wrote this up, there was some group you had not run this by. I'm trying to recall.
Food and lodging.
Food and lodging, yeah.
And the restaurants at
their own.
that point were already open, so I didn't put a lot of emphasis on that. But I did want to, at some point, bring my food and lodging people into this if it were to go forward.
Okay. Well, Dr. Engelke, would you like to make a motion to table?
Well, I second Dr. Harrell's motion if we're done talking.
Dr. Harold. All right, let's go back a step then. I'm sorry. Dr. Harold, would you like to make a motion to table? Sounds like you got a second waiting for you.
Yes, I would like a motion to table Dr. Silvernail's reopening plan.
Okay, all right. And Dr. Engelke, are you still ready to second that motion?
Yes, I second it.
All right, very good. Any further discussion or questions for Dr. Silvernail? Okay, hearing none, we'll have a roll call vote to table the reopening plan as presented.
Tina Dixon, Tina Dixon, Rex Fleming,
I agree.
Scott McIntosh,
Agree. Aye.
Natish Patidar,
Agree.
Kelly Pack-Smith,
Approve.
Lowell Spate.
Approve.
And just for clarification, Ms. Dixon's having some audio problems, but she did raise her hand.
Okay, all right.
So,
All right, very good. Motion passes then. We'll table this until we have some further further movement from the governor's office and any other clarifications that may occur in between. So thank you all very much for taking the time to carefully review. Most appreciated, and I'm sure Dr. Silvernail appreciates you doing that as well. So
Yes, thank you.
all right, we'll move on to items of new business. All we have down is the health director's report.
Okay. All right. Thank you, Dr. Ramsey. COVID-19 continues to occupy most of the efforts of Pitt County Health Department. And I would tell you and the board that Pitt County Health Department is operating at or near capacity with little or no reserve at this time. Our community testing program opened yesterday with a robust response. In excess of 416 individuals were tested at just 2 sites yesterday, that being J.H. Rose High School and the Farmville Community Center. The third site is planned to open on Thursday at the Moywood Cultural and Recreational Center. When we did this, we were anticipating about 165 tests a day. We did over 400 yesterday and today between the 2 sites, that being J.H. Rose, and our rotating site was at Bethel today. And then we did some late afternoon collections at the health department. We did north of 422 people today. So far more, about 3 times what we thought we would do. So I'm hoping that this is the COVID rush and that demand will decrease a little bit. But we have had a very robust response to our putting testing out there for the community. And the uptake has been good, far better than we would have expected. I want to mention some things that Amy Haddam, the deputy director, is doing. Amy continues to oversee our Pitt County COVID-19 hotlines. And I think we were 20-ish calls a day or more than that now. So our call volume has gone back up, and that seems to seesaw sometimes. We'll cycle up and then cycle down, but we're north of 20 calls a day on the hotline. She's providing logistical support to the COVID-19 testing program. There are a stack of directional signs outside her office this afternoon that she picked up to help direct people into the sites. And of course, she continues to provide media relations support for myself and for the health department. You've seen our vacant positions list. We did interview for the environmental health director. Negotiations are in process there. Communicable disease. We've already talked about the living with COVID guidelines. We did interestingly have 1 case of hemolytic uremic syndrome reported this month. And I teased Bill Cleve at the hospital that was impossible because there was no infectious disease except COVID out there. And Bill said, Doc, I've almost forgotten how to do other communicable diseases. Clinical services, our schedules and procedures remain modified, but all mandated services are being provided and remain available at the health department. Maternal child health, we've been waiting to see what would happen with the schools. I know Dr. Lenker had potentially invited me to come to his board meeting with the school district next week. He has not confirmed that yet. We have had some very preliminary discussions about the reopening of the schools and how we can support the reopening of the schools if and when that time comes. We know last year we had some issues with immunizations being incomplete, and especially in 7th graders. We had the meningitis vaccine was delinquent in a number of 7th graders. And we had hoped to catch them on the way out of schools, but because schools had ended so abruptly this year, we were not able to do that. We do have a plan in place to try to catch them on the front end going into school this fall or late this summer. And we'll see what actually happens with our local school district, and we will implement that. So we do have an immunization campaign planned, but at the moment it's on hold because of COVID. In nutrition and WIC, the state continues to issue WIC numbers. Our numbers are well above baseline. Average case baseline that we are supposed to maintain is 4,309, and we at this point are at 5,016 WIC clients or cases. That's 116% of baseline at the moment, so they have been out there. Previously, I've mentioned some of the WIC flexibilities that have been implemented to help with food insecurity during the COVID crisis. All of those WIC flexibilities remain in place. Our health education department, the one thing I will mention is that work continues on our prep grant activities. That grant is pretty much isolated from COVID. We have a new person in that role, and she is working that every day. In environmental health, mentioned in my previous report that food and lodging inspections had been limited due to COVID for the first part of or the end of the last fiscal year. As of July 1st, all food and lodging inspections are back to their normal requirements on an annual basis. And that is my report for this evening.
Well, very good. Thank you, Dr. Silvernail. Does anybody have any questions for Dr. Silvernail about his report? I see Lowell Spate has raised his hand.
Hey, so I want to say I rode by Rose yesterday just to watch, and I know it was kind of mentioned before, but I went out and watched them for a few minutes. They were very professional looking. It's organized. They moved well, looked hot. I hope they had some water and maybe some fans. But I did want to tell you, they did look, and they're busy too. They did look very organized. It was very impressive to watch them. So I just kind of wanted to mention that.
Thank you, Lowell. I know our staff are very hot, and I want to take a moment to thank all our staff for their hard work in this heat. We did get them some fans. Thanks to Randy Gentry and the crew at Emergency Management. We put a request in for fans, and within about 35 minutes, we had 2 fans over there to help with keeping folks cool, or at least moving the air past them in the heat yesterday. Randy's been a great partner through this, and just want to thank him publicly as well.
Very good. Any other questions or comments from the board members for Dr. Silvernail? Okay, we're hearing none. Thank you very much, Dr. Silvernail, for your excellent and comprehensive report. We'd now like to move into closed session. For the public, we will go into closed session for a short time, and we'll come out of closed session, hopefully in a short time, and then very shortly after that, adjourn the meeting. So if one of the board members could please make the motion that is Betsy kindly provided in the agenda. See, our vice chairman's not with us tonight, so it'll be someone else will have to make the motion second. Dr. McIntosh?
Yeah, motion.
All right. Can you read that motion that's listed under closed session? Do you have it in front of you?
Motion, excuse me, motion to move into closed session.
Okay, I can read that part.
Okay, all right, very good.
So pursuant to North Carolina General Statute 143, 318, 11, Section A, subsection 6, a motion has been made for the board to go into closed session for the purpose of conducting the health director's annual evaluation.
All right, and I think Natish was the next person up here.
Yes, the motion second.
Second the motion, okay, all right. We need a roll call, I guess, on the,
Yes.
to go into, okay, Betsy will conduct a roll call. Any further discussion? All right, she'll go ahead and conduct a roll call vote.
Tina Dixon,
Oh, there it is.
You raised her hand, yeah.
it seems she's still having audio problems. Martha Engelke,
Yes.
Rex Fleming,
Yes.
Scott McIntosh,
Yes.
Kelly Pack Smith,
Yes.
and Lowell Spate.
Yes.
Okay, motion passes. All right, we will go into closed session. Again, for the public, we'll be offline for a short time and then come back on and adjourn shortly thereafter if there's no additional business. So